Hi there, and welcome to another in our GoVolHerts Volunteer Spotlight series. I'm Deborah, and I'm here to help you to discover some of the many organisations operating in and around Hertfordshire, finding out exactly what they do and how you might be able to join as a volunteer. If you'd like to receive notifications when we post new content, like this video, please subscribe to GoVolHerts on YouTube and click the bell icon so you'll receive notifications. Joining me today, we've got Hertfordshire Health Walks. We have Claire, and we've also got volunteers Jan and Sue. Welcome.
Hello.
First of all, Claire, could you tell us a bit about Hertfordshire Health Walks? What is it that you do?
Sure, yeah. Health Walks is a scheme that's organised by Hertfordshire County Council, and we work with volunteers, and we set up free social short walks in the community. And we have a range of walks to suit all abilities and fitness levels. And volunteers deliver 65 walks a week across the county.
Wow.
And there's one volunteer at the front and one at the back, so everyone stays together.
Oh, great. So that's something most of us can walk. I know not everyone, but it's quite a straightforward thing that most of us probably don't even think twice about. And it also sounds like something that people can go along and try, and then maybe they really like it, then they can move on to being a volunteer for you. Yeah.
Yeah, absolutely. We have a volunteer team of more than 300 Hertfordshire residents who lead walks or lead from the back. And we support our volunteers through the Investing in Volunteers National Standard. And we're really proud that that accreditation was recently renewed this year. And so absolutely, many of our volunteers started out as regular walkers, and they gained confidence, they gained their fitness, and they realized that they were getting so much out of the walk that they wanted to give back and help other people who maybe had more barriers to getting active, and help those people experience the health and well-being benefits of walking.
Yeah, that's great. Do you need any sort of qualifications to lead the health walks, or just a bit of enthusiasm?
Yeah, enthusiasm and a joy of walking, because that kind of passion and excitement just will come through on your walk. But no experience is necessary, so you don't have to be super fit. You don't have to know how to read a map, because all the routes are already tried and tested, and there's route descriptions that you can just pick up. You do need to be over 18 and be a registered walker and have gone on at least 2 walks with us, hopefully more. And then afterwards, you would attend a half-day classroom training.
Okay, that's great. So as I said earlier, we've got Jan and Claire. No, sorry, you're Claire. We've got Jan and Sue here, who are volunteers, and they are going to tell us a little bit about their experiences. So firstly, Sue, can you tell us about your experiences as a Health Walks volunteer?
Yes, I've been a volunteer since 2005, 2006,
Wow.
so a very long time. And according to records, I've done about 2,000 walks. So
amazing.
But I fell into volunteering, I have to say. I was made redundant from my job, and I thought I love walking, and I'd heard about health walks. Because I don't know if you know, they were started by Dr. William Bird, a GP in Hertfordshire, and he got his patients walking, and he noticed that their health had improved considerably. This was in the late 1990s, I think. And after that, Health Walks was born, and they went viral. But I thought, oh, I could go and do some health walks. So I phoned. It was Countryside Management at the time, and they were based in St Albans. And they said, no, we haven't got any in St Albans. You'll have to contact the council. So I contacted the council, and the council, in its usual way, said, no, there's no money for walks. So I thought, oh, well, that's it. About 3 weeks later, the girl from Countryside Management phoned me up and said, guess what, Sue? The council have contacted us, they want to start some health walks in St Albans. So not only was I a volunteer, I was an organiser. I had to find routes and other walkers, other leaders, and everything else. So that's how I got into it. So blame me for walks in St Albans, if you like.
Oh, that's a great story. So thank you for sharing us.
That was that. But as I say, I was a nurse in my previous life. So I'd always had a job to do, making people healthier or fitter. And in the latter part of my working life, I worked in occupational health in a company just based over the road from here, but it's no longer there. And my mantra at that time was to be happy, healthy, and here. So happy, I love walking, I love being out in the countryside. I want everybody to do the same thing. We find the flowers, snowdrops, bluebells, apple blossom, butterflies, you name it, we will find it. And the walkers love that. They love to be looking for things and
yeah, it's really
healthy.
I mean, we always talk about volunteering being good for your mental health, but also walking, being out in the fresh air, chatting to some other people. That's good for your mental health as well as your physical health, isn't it? So yeah, continuing keeping Hertfordshire healthy there, Sue.
That's the happy bit, and the healthy bit. I'm generally fitter and healthier than if I wasn't walking, and I hope I look younger because walkers are supposed to look younger. I've just had a knee replacement about 2 months ago, and my consultant said to me that my excellent recovery was probably due to all the walking that I do. So that's another benefit for walkers, and we could also save the NHS some money.
Yeah, that's a good endorsement there. That's brilliant. Thank you ever so much,
the last
Sue.
bit is here. We want the walkers to be here. And another thing that I love doing is going to promote walks, things like Older People's Day and other community events. That's great fun. And I really enjoy that. But one of the highlights of my time walking was being presented to Sophie, the Countess of Wessex, as she was then.
Yeah.
She's now the Duchess of Edinburgh, isn't she, or the Countess of Edinburgh, or something like that. And she came to plant the last tree at Highfield Park, where we do 2 of our walks. And she is very keen on walking. She was very interested in our health walks. So that was quite an amazing day.
Yeah, so, that's absolutely great.
Yeah.
So Sue's been walking for a long time. She sort of instigated things by the sounds of it. So Jan, you've joined the scheme a bit more recently. Can you tell us what you've been getting up to with the Health Walk scheme?
Yeah, I've been walking as a walk leader for not quite 2 years. And I'm based up in North Herts, leading a walk in Hitchin. So it's a weekly walk. I took that on because I went to try it out as one of the walks suggested, you know, having a range of different things to do. I tried some of the longer ones, I tried some of the shorter ones. And really for me, I found that I'm really attracted to walking with people who probably need to walk the most. So the walks that we lead in Hitching are what called first steps and grade 1 walks. So they are for people entry level. On our walk, we've got quite a lot of people with health conditions, long-term health conditions, mental health issues, people who are carers, people who are being cared for. We've got a team of volunteers, so it's not just me. There's 3 other weekly volunteers who walk with us and a few people who dip in and out and help us out when we're a bit short, so that we can all have annual leave as such, and we can all have a family life existence as well. But I think what we've found is we've got a very close-knit team, and that's not just us as volunteers, that's everybody who comes to walk as well. It's a real you know, I think Sue's alluded to this, it's a real sense of belonging. So that's something I get, and I think the other volunteers who volunteer with me get. We feel like we belong, and we've got a sense of pride in what we offer. I think one of the huge rewards for me is just the interesting people I meet. You know, some people, quite a lot of people are older, and just having that time to wander, chat, have coffee afterwards, and learn about their lives, not their lives now, but what they've done before, all the wealth that they can bring and the experience. It's brilliant. It's really great. And I'm recently retired as well, and just having that luxury of time to get to know people, it does me the world of good. I love it, absolutely love it. And like Sue, I love the countryside. I love walking, I love exercise. So sharing that passion with people, some people who may have been able to do a lot more than they can do now, and they're sort of reducing what they're doing, but we're keeping it going. And other people who have never exercised, walked at all, and maybe have not been nudged by a GP or a family member to come along. It's just, you know, the diversity is great. We include everybody. Lots of people, we just say, come and try it. One of the things we've done very recently is made sure now we've got 4 volunteers that we're not all clumped together, because we've got a big range of ability within that short walk. So we can offer a little bit more bespoke sort of one-to-one walking where it's needed. I've even this week bought what's called a boot buddy, because we've got people with rollators, walking frames, and they get clogged with the mud. So I've now got this boot buddy, which is water and a brush, so we can actually clean things when we finish. So, you know, it opens your eyes to the wider world. It's great fun. And, you know, I think myself and the rest of us are really enthusiastic. We really welcome other people to come and join us. We're a walk that really, it's great when people on their training come and join us, even if they don't remain with us afterwards. It's nice to meet those people that might be going off and volunteering elsewhere. And one of the things that we do that I think Claire and her colleagues do across the county is we have a regular North Herts meeting where we meet with the other volunteers. And I think that is so helpful. Hearing ideas, networking, you know, keeping in touch, meeting people you might have heard about, because quite a lot of the walkers on our walk have come from longer walks. They're getting a little bit older and slower, and they've sort of stepped down, and you actually know who they're talking about. So, you know, that's great too. So there's lots of support, lots of enthusiasm. It's great. It's lovely. Come and join us.
Well, I'm sure that's inspired some people to get out walking and joining you. I mean, are you going out now? I'll come and join you. That's absolutely fantastic. It's you know, all the benefits, the social benefits, the mental health benefits, the physical health benefits. As you get older, the more you can keep on doing, the longer you can, you know, carry on having that quality of life. You say, oh, it'll put less pressure on the NHS, but it's about the quality of life for you as a person as well. So absolutely great. So I hope there are people out there who are going to get involved. Come along, join the walks, see how you like it. Maybe sign up as a volunteer. Maybe you'll have as much fun as Jan and Sue have been having. So thank you very much, ladies, for joining me. For you at home, I'm going to post a link to the Hertfordshire Health Walks page on GoVolHerts in the video description, so you can see if there's a training session coming up at a location near you. And we'll also link to the walk timetable. So if you want to go along and see what it's all about, you'll have all the information you need. We've currently got over 450 charities and non-profits in and around Hertfordshire promoting their volunteering roles and events on GoVolHerts. So this is giving you one place for people like you to go and browse hundreds of different roles and find a volunteering opportunity. And I hope you'll join me next time when I'll be discovering more about another Hertfordshire organisation. In the meantime, from myself and from Claire, Jan and Sue, thank you so much for watching, and I hope to see you next time. Goodbye.
Bye.